For Chapter 5, we'll be discussing health issues across the lifespan. First, I want to emphasize the importance of vaccines in infancy and childhood. Vaccines are a small dose of an inactive virus that's injected into the body. So this vaccine will not give you the illness. There is actually a myth that if you get the flu vaccine and you get the flu a few days later, that it's because of the vaccine. That's just merely coincidence. It's because the vaccine takes about 2 weeks to have an effect, and so you were already infected with the flu when you had that vaccine. So let's just get rid of that myth. It was not caused by the vaccine. Another myth that we need to get to clear out is that vaccines, they don't cause autism. Please absolutely vaccinate your children. I could go on for hours about the research that shows on so many different levels that vaccines do not cause autism. And in fact, the rate of autism in unvaccinated versus vaccinated children is actually a little bit higher. It's not a significant difference, but we see no difference. So there is no, I can't even go into detail about the amount of research that does not support a link between autism and vaccines. What we do know is that vaccines have led to a dramatic decline in serious illnesses and have saved countless lives and have also saved children from really serious disabilities like paralysis. So I strongly encourage vaccinations. Another reason why some individuals go without vaccination is just simply because of poverty. It's linked with inadequate vaccination because they can't afford them or they don't know about programs to get them for free. In childhood, the most serious concern is childhood injuries. So this is the leading cause of death in children as well as adolescents. Motor vehicle accidents and drownings are the most common cause of death, and many more children incur non-fatal injuries. That's what's shown in the chart, but the rates vary by age. And there are several individual and contextual factors that put children at risk for injury. So, for example, poor parental and adult supervision, that's closely related to childhood injury. Parents may sense that they have little control over their children, and they may hold beliefs that injuries are inevitable, that there's just nothing you can do about it, and children, they're going to get hurt anyways, and so therefore they give less supervision or intervention, or they may be distracted, and this is what leads to children becoming hurt. But on the opposite end of the spectrum, you have parents who are almost helicopter parents who, protect their children too much and never let them out of their sight. So it's a really interesting kind of gray area that we need to find in order to prevent childhood injuries, but then also protect, we need to protect children, but then also we need to let children have a little bit of freedom so that they can make mistakes and fail, and that allows for learning opportunities as well. Children who are impulsive, overactive, have ADHD, so difficulty with controlling their behavior, they experience more unintentional injuries than other children. And also there's a neighborhood disadvantage, specifically for low socioeconomic children. And those children and families with a lack of resources, that's linked to more injuries as well. Another important concern about children's health when they're young is child maltreatment. Child abuse is defined as any intentional harm to a minor, and minors are any individuals under age of 18. Physical abuse is a physical injury to a child, so hitting or kicking or somehow physically harming a child. Sexual abuse is a little bit more specific, inappropriate touching or making inappropriate comments, engaging in sexual activity, coerced or persuaded with a child, and neglect as well is particularly important when a child is deprived of food or clothing or shelter or medical care. That's also very important. So we need to keep an eye on all of those different types of childhood maltreatment, and we do see that it varies by age. For example, we see with this chart, younger children are much more vulnerable for childhood maltreatment as compared to older children. And just kind of intuitively that makes sense. Older children are more likely to fight back or leave or tell someone, whereas younger children aren't aware of what's going on. They don't know who to talk to. They don't know that what they're experiencing is wrong. So we have to be especially careful about childhood maltreatment for children who are younger. There are significant physical and socio-emotional effects of childhood maltreatment. Physical effects include typical immediate effects like bruises and broken bones and internal bleeding, which absolutely need that immediate medical attention. But then also you see an effect on brain development, and this is a more long-lasting effect of abuse. Brain damage can occur through abuse, such as when shaking an infant, but then also physical harm and prolonged stress can also alter the course of brain development. For socio-emotional effects, those kids who are abused show poor coping skills, lower self-esteem, difficulty regulating emotions and impulses, more negative affect, difficulty understanding their emotions and others' emotions, difficulty making and sustaining friendships, and they're at risk for greater psychological disorders and behavioral problems. And in particular, sexually abused children are more knowledgeable about sex than what's appropriate, and so they may engage in these age-inappropriate sexual acts and then get in trouble themselves. So whenever a child is showing some of these age-inappropriate sexual behaviors, we perhaps have to investigate, have they been a victim of childhood sexual abuse? Now, the risk factors for childhood maltreatment, we see kind of an array of risk factors in terms of childhood characteristics. Being a special needs child, unfortunately, leads a child at being more likely to be abused themselves if they have disabilities, but also if they're a preterm infant or have a serious illness, it makes them more vulnerable to others taking advantage of them. If they're temperamentally difficult, inattentive, overactive, or have other developmental problems, then caregivers and others may lash out at their misbehavior. Parents, if they perceive their child as stubborn or non-compliant, if they evaluate their child's misdeeds as worse than they actually are, if they have very strict discipline, if they're not knowledgeable about typical child development, but this is just regular child behavior, or they have unrealistic expectations, they may lash out because of what the child is doing. If they don't know what the child is displaying in their face, so they can't recognize facial expressions, they have difficulty recognizing, managing, and expressing their own feelings appropriately, that can lead to child maltreatment. If parents have poor impulse control, poor coping, poor problem-solving skills, are experiencing poverty, marital instability, drug abuse, alcohol abuse. We're getting very listy here, but as you'll see, there are lots of risk factors for childhood maltreatment, unfortunately. And then community factors, inadequate housing, community violence, poverty, if there are very few community supports. And then societal factors. Political or religious views that value independence, privacy, and non-interference in families can actually lead to more abuse. If parents and families feel like, they can do whatever they want, and society has that belief, no one will ever investigate and then protect the child. Now, mandated reporters are those individuals who are legally obligated to report any suspected child maltreatment. So they have to report it to an appropriate agency like Child Protective Services or law enforcement or something like that. And so teachers and others are typically mandated reporters, and so they have to report it if they believe that a child is being mistreated. Now, death in childhood has been declining with time. The rates of childhood mortality are highest among infants. Children are much more likely to die in the first year of life than they are at older ages. And the chart on the slide shows the death rate for children of different ages in the United States across time. And this is the rate per 100,000 people. And this shows similar patterns across the world. And the fact is associated with childhood mortality. So what leads to death in children and adolescents? Low socioeconomic status, poor access to nutrition and medical care, and also stressful home and community environments. There are a variety of factors that lead to childhood death, And if you trace this timeline back even further, we've seen a very, very sharp decline before this because of improvements in medical care and medicine. Before, it was much more common for a child to pass away before the age of 5. This partially led to families being so large because it was kind of expected that many children wouldn't make it past the age of 5 anyways. And the reason why we see many children live for longer ages now is because of improved health care, like with antibiotic medication. In adolescence, a really strong concern is with the development of eating disorders. And I've mentioned this before with the change in body composition of young girls. So especially girls may become dissatisfied with their body image because they go from being a slim child to a young teenager and almost a woman who has a little bit more fat on her thighs and her butt and her stomach. And that is also against the societal ideal of what a woman should look like. So this concern about body image may emerge in adolescence or adulthood, and this places them at risk for eating disorders. Anorexia is when a person engages in behaviors such as starvation and extreme exercise in order to achieve thinness and maintain weight that is substantially lower than expected for his or her height or age. And they tend to perceive themselves as fat and overweight due to a distorted body image, though actually they're underweight. Those with bulimia nervosa show recurrent episodes of binge eating, consuming an abnormally amount of food in a single sitting, coupled with a feeling of being out of control and kind of almost dissociating, not feeling like they're really there and just eating to eat, followed by purging, that's that inappropriate behavior to compensate for the binge, such as vomiting, excessive exercise, or use of laxatives. So that's something that we want to keep an eye out for as it develops in adolescence. There are serious health risks associated with eating disorders. For anorexia, those women or young girls may not experience their first periods, or they may stop menstruation. They experience bone loss, kidney failure, shrinkage of the heart, and brain damage, and it can also lead to death. For bulimia, there are nutritional deficiencies because they're taking in calories but then expelling the calories in some way. That can lead to serious bad breath and tooth damage, sores, ulcers, and holes in the mouth and esophagus because they are making themselves throw up much more frequently. So therefore, it's an increased risk of cancer in the throat and esophagus. Now, I could go into much more depth about the causes of eating disorders. And if you're interested in this, I really encourage you to take Psych 35, Abnormal Psychology, because we spend an entire day speaking about eating disorders. But just very briefly, there is a genetic link for eating disorders. We've established that with twin studies, as well as personality factors. The need for perfectionism, and this kind of evolves a form of control in a family that's very overly demanding and difficult to please. And so because you can't please your family or ever meet their standards, the way that you establish control and have some type of standard in one's life is by having this eating disordered behavior. So it's a form of control, particularly with anorexia, and at least it reduces negative mood. Now, we do see these eating disorders occur in all ethnic and socioeconomic status groups. Girls involved with sports and activities that idealize lean figures are at a higher risk. So think about diving, gymnastics, dance. You're more likely to see disordered eating within those populations. And white and Latina girls are at a higher risk than African American girls. Now, in terms of treatment for eating disorders, they're very difficult to treat. Hospitalization may be required in order to remedy malnutrition and ensure weight gain, because some young girls and women come in who are just on the verge of death because they have starved their bodies so severely. Anti-anxiety and antidepressant medications can be helpful to balance neurotransmitters, balance the function of their brain quite a bit. But beyond that, you'll want to engage in individual and family therapy. Anorexia is harder to treat than bulimia, and that's because they're less likely to believe that they have a problem, that they may actually truly see themselves as not having disordered eating, as compared to those with bulimia who see themselves as throwing up and having this kind of ups and downs of disordered eating, and better be able to admit to themselves that they have disordered eating problem. In adolescence and emerging adulthood, alcohol and substance use and abuse becomes a significant problem. Alcohol and substance use are very common in the United States, and to some extent might even be considered normative. It's kind of like a joke of the college students who drink too much or get blackout drunk, or the frat parties that have lots of beer. So that can lead to problems of drinking and substance use. Substance experimentation may actually be kind of developmentally typical for teenagers. So going out and experimenting and trying a drug or going out and drinking alcohol kind of separates you from your parents. It gives you that rebellious independence and allows one to form social relationships and learn about oneself. So that can kind of be normative, but then also serve the foundation for substance use and abuse. So it's something to really keep an eye out for. Substance use typically increases during the transition to adulthood. So going from child to adolescent to adulthood, you see an increase in substance use, but then it declines with the transition into adult roles. So becoming parents or owning a house, having a job, then it's not so convenient to engage in some of these behaviors. This chart shows alcohol use and abuse over time with age, a bit of the rates. There are some significant biological effects on adolescents in particular, so teenagers in particular show a reduced sensitivity to the effects of alcohol that serve as cues to limit intake and aversive effects. And they're more sensitive to neurological damage and show more cognitive impairment in response to alcohol. Those who binge drink, which is kind of considered to be 5 drinks for men or 4 drinks for women in one sitting. This tends to peak in young adulthood and is associated with negative short and long-term consequences. Of course, in terms of short-term consequences, binge drinking can lead to not fulfilling your obligations for your job or finishing your work for school, and getting in trouble with the law and making poor decisions. And then in terms of long-term consequences, it can have a serious effect on your body, your liver in particular, as well as your brain. Most people show a spontaneous decline in drinking as they take on those adult responsibilities, as I said before. In terms of tobacco use and abuse, now there are health consequences associated with smoking, which I'm sure that you've heard about before. It's associated with cancer, and this is responsible for 1 in 5 deaths in the United States each year. It's also linked with coronary heart disease, stroke, heart attack, vascular disease, and aneurysms as well. Now, most people have trouble stopping smoking because it's highly addictive, and the withdrawal symptoms begin quickly and include irritability, craving, anxiety, as well as attention deficits. I've heard from some people who have been addicted to other substances that smoking cigarettes in particular is one of the most difficult habits to quit above and beyond other much more hard drugs. Now, with e-cigarettes or vape pens, they're often used as an alternative to tobacco cigarettes because they're viewed as safer, but there's really limited research on their safety. They've only been around for so long, so we have some research showing that they're safer than cigarettes, but not as safe as just breathing air. You're still breathing something in, and it can damage your lungs and lead to long-term consequences. But We also don't have the research on 10, 20, 30-year outcomes because vape pens are still relatively new. Marijuana is another common substance used in the United States by young adults, as well as adults. It's legal in many states at this point. And there are many reasons why people use marijuana: experimentation, coping with problems, relaxation, enjoyment, and it can be medically beneficial in many cases. There are problems associated with the use of marijuana, health problems, so having a cough, chest illnesses, cancer. It's also associated with cognitive difficulties, so poor executive functioning, reasoning, planning, making decisions, regulating emotions, concentration. Also personal problems: lower academic attainment, lower income, more unemployment, for relationship satisfaction, conflict with partners, and for life satisfaction. And marijuana, many people will say that it's not addictive, but in fact it is. There is absolutely an addictive nature of marijuana. The active ingredient is THC, and this passes from the bloodstream to the brain and activates the brain's reward system. And when a person has THC for a consistent amount of time and then goes without it, this produces withdrawal symptoms: irritability, difficulty sleeping, and anxiety. So there absolutely is an addictive component to marijuana. Moving on to health problems in adulthood. Cancer, unfortunately, is a significant problem in adulthood, and one of the reasons why it has become much more prevalent is because we have better medicine. We are better able to treat infectious diseases, especially those that are bacterial in nature. And so people are living longer, and when we're able to cure infectious diseases, this means that we're living longer, cells replicate more, and there is more opportunity for those cells to experience mutation or for those cells to kind of replicate out of control. So cancer occurs when there's a genetic program that controls cell growth and it's disrupted, and then abnormal cells rapidly reproduce. And then also these cells spread into other normal tissues and organs and then take over the supply from those tissues and organs and cause those tissues and organs to shut down. This is the leading cause of death in adulthood, and it's more common in men as well as low socioeconomic status. Influenced by many factors: genetics, so if it runs in your family, you have a higher risk for that particular cancer, as well as lifestyle factors: workplace exposure to toxins, health-related behaviors like smoking or making fewer visits to the doctor, inadequate access to medical care, poor diet, as well as high stress are all related to a higher risk of cancer. Diabetes is a disease marked by high levels of blood glucose that leads to damage of the body. And the body is unable to regulate the amount of glucose in the bloodstream because there's not enough insulin produced, that's diabetes type 1, or because the body shows an insulin resistance and becomes less sensitive to it, and that's diabetes type 2. The symptoms of diabetes are fatigue, thirst, blurred vision, frequent infections, and slow healing. And in order to manage diabetes, one must carefully monitor their diet as well as and perhaps self-injection of insulin. And causal factors include genetics, especially in type 1 diabetes. Type 1 diabetes is more likely to occur in childhood and adolescence, where, in a typical weight child with, typical activity level, they may just not produce enough insulin. That leads to diabetes. That's very genetic. In diabetes type 2, it's more likely to be these contextual factors, although genetics still plays a role. Obesity, poor health, and a sedentary lifestyle. Problems due to diabetes include a risk for heart attack, stroke, circulation problems in their legs, which can lead to the need for amputation, blindness, and reduced kidney function. Cognitive effects: a decline in executive function, processing speed, memory, and motor function, and it's also linked with depression as well. Cardiovascular disease is also known as heart disease, and the markers include high blood pressure, high blood cholesterol, a plaque buildup in the arteries, irregular heartbeat, and heart attack. And the risk factors include heredity, genes, increase your likelihood for cardiovascular disease, your age, your diet, if it's heavy and saturated in trans fatty acids, and smoking as well. And for treatment, you can take some medications to decrease the problems from heart disease, and also behavior changes, increasing physical activity, changing your diet, and consuming fish oil may also be associated with decreasing your risk for cardiovascular disease. Especially in later adulthood, a problem is osteoporosis, a disorder characterized by severe bone loss, and this leads to brittle bones and easily fractured bones. And this I've mentioned briefly before. There are gender differences in osteoporosis. Hormonal changes accompanying menopause, that's associated with bone loss for women. Men, for them, they experience more gradual and less extreme loss of bone. Risk factors include heredity, genes of course, and lifestyle factors, a sedentary lifestyle, a calcium deficiency, so make sure that you drink your milk or take supplements, cigarette smoking, and heavy alcohol consumption. Arthritis is a degenerative joint disease, and there are more than 100 types of arthritis. Osteoarthritis is a condition that affects the joints that are injured by overuse. So that's more common in the joints, hips, knees, the lower back, as well as your hands. The cartilage that protects the ends of the bones where they meet at the joints wears away, and the joints become less flexible, and then they swell. Aging is a prominent risk factor in osteoarthritis. Rheumatoid arthritis is different, and this is an autoimmune illness in which the connective tissues, the membranes that line the joints, become inflamed and stiff. They thicken, they release enzymes that digest bone and cartilage, often causing the affected joint to lose its shape and alignment. That's not an age or use-related disease, but can be related to illnesses. There's a predictable age-related increase in motor vehicle accidents, depending on age. You can see this U-shaped curve here for motor vehicle accidents. At the younger end of the spectrum, we see more crashes per million miles traveled, and part of that is because of risk-taking behaviors and inexperience of drivers who are younger. But then we see another curve up on the right-hand side at the older ages, and the increase of accidents at older ages may be because of a decline in vision, so trouble with night vision and reading the dashboard, or changes in working memory and attention, and that may lead to a greater likelihood in getting in a motor vehicle accident in older adulthood. Just a reminder, falls are a major risk in older adulthood because they can be such an impact on the body that they can lead to death. And so it's really important to keep those bones strong and help an older adult maintain balance. Aspects that increase the risk of falls, more difficulty with vision and hearing, and that maintaining balance and that presence in space. And because they have those more brittle bones, it's a greater risk of a severe fracture, whereas younger individuals are more able to experience those falls and not have such a severe impact or a bone break for their body. Dementia, which is now known as neurocognitive disorder in the DSM-5, is a deterioration in mental abilities because of changes in the brain. So this affects thinking, memory, comprehension, emotional control. You see impaired thought and behavior, and it interferes with an older adult's ability to engage in everyday activities. And it goes quite a bit beyond that in this difficulty in understanding the world. Alzheimer's disease is one example of a disease that leads to dementia. This is a neurodegenerative disorder. it progresses from just a general cognitive decline, just forgetting words or having difficulty with directions, and eventually it leads to very severe difficulties in understanding the world and remembering people and in taking care of oneself. And the chart shows that risk grows exponentially with age. And unfortunately, there is quite an exponential prevalence that is expected because of the baby boomer population. We should see quite a growth in those with Alzheimer's disease, and other aging diseases as well, just to be honest with you. So those in the healthcare industry should see a booming in jobs as the need to take care of older adults grows with the aging baby boomer population. So I've given you a picture here on the lower right-hand side of a healthy brain versus an advanced Alzheimer's brain, and you'll see the difference in that the brain has become a little bit more shrunken, and there is more space in between the folds of the brain. Those with Alzheimer's disease experience inflammation that causes the beta amyloid to accumulate and join with clumps of dead neurons and glial cells, forming large masses called amyloid plaques. And the amyloid plaques contribute to the formation of the neurofibrillary tangles, these twisted bundles of threads of a protein called tau that occur within the neurons when the neurons collapse. And so the brain experiences these structural changes, these changes almost on a microscopic level, and it leads to these outward difficulties with memory and functioning and recognition of the world around them. So Alzheimer's disease is a little bit tricky because you can't diagnose it unless you actually dissect the brain very specifically. You need the presence of the beta amyloid plaques to assess and to specifically diagnose Alzheimer's disease. You would need to see on a microscope the beta amyloid plaques, and that can only be assessed in a post-mortem examination after the person has already passed away. So generally, Alzheimer's disease is diagnosed through exclusion. You rule out all other possible causes of dementia. And advances in brain imaging have offered some opportunities to diagnose based on changes in brain volume and activity, but really we need more research before we can use these other techniques. We do know that Alzheimer's progresses through several predictable steps. There's an impairment in memory, and usually it's just attributed to absent-mindedness or just getting a little bit older. So that's the stage where it's kind of gray, it's kind of fuzzy. We're not quite sure if this is Alzheimer's or something else. There are cognitive impairments that broaden to include a severe problem with concentration and memory problems, not being able to focus or remember anything. A person may become depressed or angered or anxious. As the disease progresses, the person becomes unable to care for himself or herself. So they forget to eat, they forget to dress properly, they are unable to take care of themselves in the bathroom or in the shower. And eventually the brain will fail to process information. They're no longer able to recognize objects or familiar people. And then in final stages, they lose the ability to comprehend and produce speech, to control their bodily functions, and to respond to any stimulus around them. They'll show a heightened vulnerability to infections and illness, and this is what often leads to death. Eventually, the brain functions deteriorate to the point where the organs fail and life cannot be sustained. The average patient progresses to the final stage over the course of about 10 years. So it's a bit of time for Alzheimer's to progress, but it's a very painful time for themselves and for their family. And risk factors include, well, it varies depending on gender, age, and ethnicity, but women are at a greater risk. African Americans and Hispanics are at a greater risk. It runs in families. There is an identified gene that you can get tested for to see if you're at a higher risk, not determined, but at a higher risk for Alzheimer's. And then also contextual and lifestyle, having a high blood pressure, obesity, leads to a higher risk, but education is a protective factor for Alzheimer's disease. Vascular dementia is the second most common form of dementia. It's caused by strokes. These are blockages of blood vessels in the brain. Typically, these strokes are small and unnoticeable, but with each stroke, the brain cells die and there's an immediate loss of mental functioning. They tend to show sudden but often mild losses with each stroke, and they might show improvement due to the brain's plasticity, but additional strokes make it harder for the brain to continue to compensate. And this is influenced by genetic and environmental factors: obesity, diabetes, cardiovascular disease. It's more common in men. Smoking, heavy alcohol use, inactivity, stress, and poor diet all contribute to this condition. Parkinson's disease is a brain disorder that occurs when neurons in the part of the brain called the substantia nigra die or become impaired. Neurons in this part of the brain produce dopamine, which enables coordinated function of the body's muscles and smooth movement. Parkinson's symptoms appear when at least 50% of the nerve cells in the substantia nigra are damaged, and it produces these symptoms. So tremors, slowness of movement, difficulty initiating movement, rigidity, difficulty with balance, and shuffling walk. Additionally, brain functioning declines, cognitive and speech abilities deteriorate, may lead to dementia, and finally death occurs. In terms of genetic factors, there's a lot of research showing that there's a genetic component. And in terms of environment, really physical activity serves as a protective factor, but we don't see major environmental factors triggering this disorder. Now, it's difficult to diagnose and treat. There's no test to confirm the presence of the disease. Again, we have to use diagnosis by exclusion, that everything else is excluded, so it must be this. We can treat symptoms. We can use deep brain stimulation and resistance training. And also medications that either replace or mimic dopamine can be effective and helpful. Now, last bit here, reversible dementia is a condition that's often unrecognized or untreated. These are symptoms of dementia that are caused by psychological and behavioral factors that can be reversed: social isolation, poor nutrition, dehydration, drugs and drug interactions, depression and anxiety. So any symptoms of dementia that you observe in an older person, you shouldn't just assume that it's Alzheimer's disorder. You should absolutely ask for them to be checked out, have them be assessed, and see if it's something that can be reversed. All right, thank you, everyone.